Everything was going as planned and the future looked bright for Dr. Marnie Rose. She was just 27 and in the first year of her pediatric medical residency. Then the tables turned. The doctor became the patient when she was diagnosed with a rare form of brain cancer. Despite her diagnosis, she agreed to share all: her cancer journey, personal life, and professional duties.
Hi, sweetie. I'm Dr. Rose, just like the flower. Ask the nurses, they can come get me. I'm Dr. Rose. How are you? Hi, beautiful. You've got the windblown look in your hair right now. I'm a pediatric resident at Herman Hospital. I want to be a pediatrician. I've been wanting this for my whole life. How are you feeling? How are you feeling? How are you feeling? Okay, that's what I thought.
Dr. Rose was determined to keep working despite her illness. She was candid about her disease and her positive attitude in the face of adversity. Dr. Rose passed away on August 23, 2002 from complications of her cancer. Today, her legacy continues with the Dr. Marnie Rose Foundation, giving more than $7 million to brain cancer research and helping patients in their fight as well. Ava Klein is a brain tumor survivor. She is joined by Deborah Rose with the Dr. Marnie Rose Foundation. Good morning, ladies.
Good morning.
That was tough to watch.
It was tough.
Yeah,
it was tough.
You can't help but notice that you have the same last name as Marnie. Explain the relationship.
Yes, Marnie was my dynamic sister-in-law. My husband Miles was her twin brother, and she was a pediatric resident fighting for her life. Amazing woman, and my beautiful mother-in-law, who's in the audience, started this foundation in her honor to fight for her.
Watching that piece, I did not know her, but just the very little clip that I saw, what an amazing human being.
She was amazing. Amazing.
All right, so when the diagnosis first came, that had to kind of shock everybody. For number one, we think of something like brain cancer. So oftentimes we will hear about it in younger kids like Ava, but older adults and mostly men, right?
Right. And it's not. It is people of all ages, men, women. We're hearing celebrities now in the news, Isabella Strahan. All kinds of people have brain cancer, and it's something that we have to just keep fighting for.
Yeah, and this points to the importance of the research, because it has to be research done in various populations, right? Again, people thinking, oh, it's older men, don't worry about it. But when you have research that you can refine who really is at risk and then what we need to do about it. What types of symptoms was she having?
Well, she had headaches, and in the beginning, and I think her leg was bothering her, and then she was having some seizures.
Yeah, we were talking in the green room earlier that things can happen. We sometimes think it's all up to medicine somewhere. Like where is that? To take care of things. It's not. All the cures and better protocols really have come from people who got mad and stood up and said, we're going to get mad and stand up against the disease. The Houston Medical TV series. Marnie went on there and she pulled off her wig because she wanted people to see the real deal.
She did. She was so brave, and she fought like a true warrior.
Yeah.
Till the end.
So the foundation is set up to?
The foundation is set up to eventually find a cure for brain cancer. We have research that we give to MD Anderson, Memorial Hermann, and UT McGovern. And we've given over $7 million.
That's incredible.
We went and toured a couple weeks ago the facilities. The research is amazing. They have, new machines. They have doctors just working, and we've made millions of
technology has changed.
Yes,
which basically less collateral damage in how we treat brain cancer. There was a time when they say we can do this, we can get rid of that tumor, but we're going to have some brain damage that's associated with it. And today they can almost laser focus in on that tumor. Right?
Exactly.
And because of research like that, we have beautiful Ava sitting here. So Ava, tell us what was happening with you. I know in the very beginning you don't remember that. Your parents had to tell you what happened, but what was going on with you?
So I think I was experiencing headaches. I was throwing up a lot.
Yeah. You were only 2 years old.
Yes, and I was like losing my balance. Couldn't focus, I guess.
Yeah.
I don't know.
But it was a tumor, right?
Yes.
And that they were able to remove. You don't remember that part, but you've had some surgeries since then.
Yes.
What surgery did you have since then?
Well,
They said
I had
it's
a
fine.
lot.
They had to take care of some things.
Yeah,
It's hard. I had brain surgery for an aneurysm years ago, and it's a big thing that you go through when somebody's going through your brain. But how does it make you feel that people will come out to support this foundation, whether they have a loved one who's dealt with it or not, to see the community come out in support of making things better for the next set of children or the people who deal with brain cancer?
I mean, it makes me feel good, happy that there are people who care and come out to support. Because cancer, no one deserves to go through cancer or anything like cancer.
Yeah, you've gone through the 6 rounds of inpatient chemotherapy, 3 high-dose rounds, 30 straight weekdays of proton beam radiation, and 12-cycle clinical trial. But all of that can happen because of the research dollars that are put into it, and that's why you're sitting here today. And today you're a sophomore. You've got your hobbies, your passions. You're involved with the foundation, and so you're able to live your life to the fullest right now. All right, the Run for the Rose. Tell us how it's all set up.
Well, first I wanted you to notice Ava's beautiful shirt. This is
Ava's Army. She's not messing around. She's got a full army,
this is her team. And this is her team. One of the big things, our run is this coming Sunday at Rice University, and we have amazing teams that raise so much money and are there and enthusiastic. And you know, we're looking forward to, this is our 20th run. We had a year off for COVID, but we just are looking forward to seeing everybody out there bright and early. You know, like I said, we're raising money for research so that we can knock this thing out. And this is our shirt for this year.
Yeah.
So pretty blue color that everybody participant gets one.
Now it's called the Run for the Rose.
For the Rose, yes.
If I should be walking.
And we hope you are. And yes, it is definitely for walkers and runners.
Yeah,
we have both. We actually also have a family 1K that's just, this year it's going to be a loop around the Rice Stadium. It's going to be beautiful. And the post-race party is going to be in the stadium.
I mentioned earlier how I had done some stuff with Nancy Brinker years ago, decades ago, with breast cancer, and we would see a few people out there with the pink hats, and today you see a sea of pink hats. That's what you want, is like, and that's what you're seeing is more and more survivors, not only survivors, but thrivers.
Let me tell you, before our run starts, we have a survivor stroll, and all the survivors come with their yellow flags, and it is just, it's beautiful to see everybody and the progress that's made. And you know, our foundation thanks everybody. We're very happy.
What do you have to say to somebody out there who's been diagnosed recently?
We're fighting for you, and you know, we're praying. We please come find us. We not only do we have the run, but we're also there for our friends and patients. And we say, always call us, because we've given meals. We do things for our patients other than raise money.
And Ava, what do you have to say to a child that may have been diagnosed with something tough like this?
Don't give up hope, because there is hope out there that you can continue fighting through cancer or any other illness that may
challenge you.
Yes.
But you can get through it. All right. And we can help in that effort with Run for the Rose. Ladies, thank you so much.
Thank you so much.
Thank you.
To learn more about the Dr. Marnie Rose Foundation or to sign up for this weekend's Run for the Rose, visit their website at drmarnierose.org.